Back to corrective movement therapy. Today we're going to be talking about applying the Voodoo band to the elbow. Reason for doing this, we're getting a lot of people complaining. Ask the question, well, why does my elbow hurt when I'm going into overhead extension with a decently heavy weight? A lot of my swimmers and a lot of people that are doing a lot of pressing and pulling. Reason being, a lot of tight musculature, joint restrictions, all that type of hypermobility, hypermobility, it doesn't really matter. Pretty much what happens, a lot of the tricep locks up with all the external extrinsic muscles of the forearm all the way up to the shoulder. So what we're going to do is today we're going to try to break up all that tissue that's built up, whether it's all the years or through all the motions that you're doing within your sport or lifting. So what we're going to do is we're going to be here, attach to the top. You always want to pull proximal to distal with this. Going all the way over, not pulling over the bone, the elbow bone over here. Coming down under, going right back up to proximal. Then coming right back down distally underneath the elbow, locking up. Keeping the palm up on the patient. All right. So what we're going to do with this, if any types of swelling and different types of that, numbness, tingling, just unwrap it and then hook it right back on. You should probably just wrap it a little bit too tight. You really want to have it a nice discomfort, just not too tight. Otherwise, you're not going to get the results you want. A little bit of tissue hanging out at the end. So what we're going to do is we're working to a flexion and extension all the way up, really forcing that extension when he gets there. Right back up. Playing around this area for like 15 seconds, coming down to internal rotation all the way to external. Internal, external, then add the rotation with it. Trying to work in all different types of directions in the movement of this elbow. Keeping it still, really moving that forearm, hand. Taking it off, into our test retest. Taking a look, he's got about 1 to 2 degrees difference. Elbow extension, right back to normal function. That's a corrective movement therapy for the week. Next week we'll be out using the ball underneath the rotator cuff, trying to get a little bit more into overhead extension within the back underneath the scapula. We'll catch you next week. Thanks for stopping by.